what is it about breast preference? So we'll talk about what causes it. Is it a problem? And when does it happen? And how do we get the baby back to that breast? So I'll start by telling us that just naturally, by creation and anatomy, all our features are not the same. Even if you look closely, your left nose is not equal to your right. So the same, your breasts are not equally the same. One breast is bigger than the other, but sometimes they are not obviously bigger such that everybody can notice, but using your own eyes you can look and see yenyewe the left one is bigger than the right one. Same to milk production. When it comes to milk production, what happens because of the anatomy? Anatomy is not a very huge word. Anatomy means maumbile. Yes, vile tumeumbwa, it's different from one another. So I hope you can see this. This is an image of a breast. This here, they look like flowers, right? This is the milk gland, and this is where milk is stored. And then you have the milk duct that supplies the milk. So when the milk is produced, it stays here, and then it goes through the duct, through the areola, where the baby now sucks, and to the nipple, all right? So let's talk about the right, for example. Your right breast might be having more of the milk glands, right? And definitely will store more milk compared to. But this is just one of the many examples. So when you ask yourself, why is my right producing more milk than the left? Probably it's the anatomy. One of the breasts has more milk ducts and more milk glands than the one that is not producing enough milk. So that is when it comes to the anatomy. Number two is the nature of the breasts, all right? One breast might have a nipple that is usually like this, well erected and ready to feed, and some breasts might have a flat nipple, and worst case scenario, some breasts might have an inverted nipple. So definitely, even your baby will prefer a nipple that is ready for latching. All right? Tell me if you can hear me clearly, if you can hear us. If you can hear me, type any question. We will try to go answering as we go on with the session. So by this I'm talking about the anatomy, the creation, maumbile, of our beautiful breasts. So your baby might prefer one breast to the other according to the anatomy. For example, a breast that has more milk ducts will have more milk. And if your baby is a good feeder and does not fear a letdown is what happens during letdown is when the baby is suckling and suckling, then the milk just comes out. There's that nice tingling effect that you might feel on your breast, and you'll know that the milk is coming. Some mothers even have milk letdown when they are in the market, and you're like thinking about your baby and baby is crying. You feel that effect where your breast is really ready to produce that milk. That is what we call a milk letdown. So what happens, some babies fear forceful letdown. So when the baby is feeding and then there is that gush of milk and the baby runs away, does not want that letdown. So for some people, they will stop feeding the baby that breast, and they'll be like, anytime I put my baby on this breast, baby runs away. Baby doesn't like it. I position my baby this way. Already the baby knows that that is the breast that produces a lot of milk, and I don't like it. But to some children, that's a joy. So the opposite is true. When you put the baby on the breast that has a slow, a trickling down, let down, pole pole, they will run away and they're like, no, mama, you're giving me a raw deal. I want that one that is chap chap, has a very forceful letdown. So it's good to take your time and learn your baby and know what exactly your baby wants. We shall talk about the solutions. Let us start by discussing if it's a problem and how to notice that your baby is preferring one breast. Then we'll go to the solutions on how to bring back your baby on the breast. All right. So we've talked about milk letdown and the definitely supply of milk. The other one is when you put your baby on one position and the baby is crying and the baby is not comfortable to be on that breast, ask yourself, is my baby in pain? Right? Sorry. Is my baby under the tree manenos? Is my baby in pain? Because if you are holding your baby this way, all right, we'll discuss about the positionings very soon. So if you're holding your baby this way, I hope you can see me properly, and then your baby is crying, it's okay to just get your baby and have time and look at your baby. Is it the immunization side that is making your baby uncomfortable? Does your baby has an ear infection? Is it something that, does your baby have a trauma or something? Just take your time and examine your baby, because probably you want the baby to breastfeed on the right side, and the moment you bring the baby on the right side, the baby does not want. The baby cries. The baby becomes fussy. The baby becomes, unconsolable. Just make sure that you've taken your time, look at your baby, and just try to figure out exactly what is happening. All right. The other thing is breast trauma or breast surgery. Some mothers have breast surgeries for whatever reason, or trauma. So definitely that breast will not produce as much milk compared to the other one, and baby will be a little bit fussy on it. And then last but not least is maternal preference. Some of us mummies prefer to give our babies one breast, and this is particularly the left one. Why? Because what happens, mommy holds the baby like this on the left and the right hand is free. So what will happen, you can pick your phone and talk over the phone, you can take your remote. I mean, the right hand side is free. It can do so many activities when it's free. So unconsciously or subconsciously, mothers tend to hold their babies most of the time on the left side. Okay, so because this breast on the left side is the one that is being used all the time or almost all the time, it will even produce more milk. It will be an active breast. It will have a lot of milk. Baby is comfortable and feeling loved to head this side. So what will happen? The moment you bring your baby on this side, strike. All right. So it's very good to, as mothers, to try to hold baby on all the breasts and introduce all breasts equally. All right. So those are the causes. So let us go and see what can we do as a mother or as a parent. What can we do? Some of these recommendations may not be, you may not do anything about it. For example, the anatomy one, the way your breast is created, you can actually not do much about it, but at least you can bring the baby almost all the time to that breast. So how do you introduce your baby to this breast that the baby does not like? Okay, we have to be a little bit brighter than our children, number one. So if baby does not like this breast, the right side breast, all right, what my number one, after you've already inspected your baby is fine, there is no ear infection, you even gone to see the doctor, there is no ear infection, the immunization site is not sore, there is no trauma, either birth trauma or baby fell down or any kind of pain, then that means it's because of the breast. We now come back to the breast after ruling out all other causes. So bring the baby on that side that he likes or she likes. If she likes the left one, bring the baby on this side. Let the baby get comfortable and start breastfeeding that side. I really want you to look at this. Huh? Yes, so I'm holding my baby like this and baby is breastfeeding. Once the let down starts coming, try to change to the other breast without changing the baby's position. Look at me. I'm going to do this. My baby is feeding, and I will bring the baby to this other breast and use the clutch. We call this position clutch position to secure my baby and continue feeding my baby from this other side. Did you get that? I did not change, I changed the breast, but I did not change baby's position, all right? So the baby is still on this side, all right? Breastfeeding this, and then there's a let down. I say that tingling. When you feel your milk is really coming down, then just switch your baby to this other side, all right? The baby will be a little bit confused. He doesn't know what has happened, but still lying on the same side, all right? So that is number one. Number two, try to feed your baby when your baby is a little bit drowsy. So that means when your baby is about to wake up, you know the way they wake up and they start rooting. Rooting means looking for the breast, so they start eating their fingers and anything they find close. So during that time when they are still half asleep, half awake, introduce that nyonyo that the baby does not like. All right, just introduce it and see how it goes, because sometimes the baby is thirsty but not necessarily hungry and has woken up in between the sleep pattern. So what you do, just introduce that breast and see what the baby does. If the baby is very much alert, we'll definitely know, this is the awful nyonyo that I don't like. So just switch and use the other one. But this method of trying to breastfeed your baby when your baby is a little bit drowsy, or when your baby is half awake, half asleep around there, introduce that breast. So the other thing that number 3 point is that breast that does not supply a lot of milk, that does not have an adequate or a gushing let down, keep pumping. Keep pumping. Huh? I have my friend here. Oh, I have this friend of mothers that I like very much. There are so many different brands in the shop. So when baby is feeding on the most favorite breast, you can introduce this pump on the other breast. You just create a vacuum and it holds the other breast, and you can comfortably continue breasting your mom. It's not like a pump that you'll keep pumping, but it will fetch the milk. So this means that breast will constantly be active, and I will encourage you to keep pumping, like increase the pumping to twice or thrice or even 4 times of what you pump on the favorite breast. By this you'll create a demand from this breast that baby does not like, so that it can also come up and start having a nice flow of the milk. We've talked about how to bring baby back on that breast. Just keep trying. And that one for the ear infection, you can ask for help. That is why Mamatoto is here. That is why I'm here as your lactationist. That is where we have so many doctors. Reach out, call that baby is not feeding on the right breast. The other one that, sorry, I forgot about the breast anatomy is it comes to the size of the breast. I talked about an inverted and a flat nipple. There's also that a very big nipple, but with a good latch. This nipple does not matter. With a very good latch that you'll definitely be taught, it does not matter. Your baby can do this. So all that I'm talking about when it comes to breasts preference, also called lopsided, is persistence and patience. Parents, persistence and patience. I repeat, persistence and patience. Be very patient with your baby. Babies are not the same. Just be very patient with your baby. Be very patient to yourself as well. Do not start beating yourself and self-guessing that you're not a good mommy. You are the best mom to your baby. So do not second guess yourself. Do not start struggling and saying, why did my firstborn, secondborn did so well, my secondborn is not doing so well? No, be very patient with yourself. Like I said in my other previous post, is even if you're a 10th time mom, this particular baby you're breastfeeding at that time is your first baby at that moment. You've breastfed every other one, the number 1, the number 2, the number 10, but this one you're feeding right now is the first baby you're breastfeeding. So do not compare your babies. Do not compare how they behaved. do not compare how you did is, did you know if you have a breast infection or if you have a breast, like a blocked milk duct or a mastitis, your milk might change flavor? Yes, your milk may settle down for a while. It increases and absorbs a lot of sodium and becomes a little salty, and it might make your baby not want to breastfeed. So if I don't get somebody who will bring, thank you, Alinda. If we do not get any person who will bring for us a topic for tomorrow, tomorrow we can talk about nursing strike. Yes, you may wake up in the morning one day, you want to feed your baby, and your baby is looking at you like, I'm not gonna feed. I do not want to breastfeed. This time not on one boob, but both. They refuse to feed. And mothers get frustrated. Why do our breastfeeding babies just wake up one day and they have a nursing strike? See you tomorrow at exactly 2 p.m. Tag, 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 tag a mom. We are in this together. Thank you. And Irene, thank you for coming. Is it okay to feed baby with water in the first 3 months? Thank you, Irene. Thank you so much for that. That's a good question. I will not postpone that question for you. We do not give babies anything the first 6 months, all right? Milk itself is a fluid. And let me tell you one beautiful thing about breast milk. Breast milk. We have 2 types of breast milk. We have fore milk and we have the hind milk. Fore milk, it's from front, all right? The front milk and the hind milk, behind milk. So Irene, the fore milk is water. It's there to satisfy baby's thirst. Baby has just woken up, baby is thirsty, so they do what? Oh, they gallop. That is just water, and it's usually very clear even if you press it. So as the baby is feeding and drinking, so baby goes to the hind milk. Remember our diagram? Remember our diagram here? So here, this is fore milk, where we get the fore milk, and this is where the hind milk is. The hind milk is nutritious and very thick, and the fore milk is very watery. It satisfies baby thirst. So that is the water that the baby takes. The rest is thick and very nutritious, and that is what helps your baby increase the weight. So Irene, I hope that one answers you. If you are not satisfied, please call me. I'll drop my line and we'll talk about it. Alinda is asking for breast engorgement. What will be your first line management? Cold or warm compress? Thanks, Alinda, for the question. For engorgement, my first management is cold compression. Why? Because we want to cut. We want to cut. We want to break the demand and supply curve, all right? So we usually use the cold compress, and then now we express that milk so that that breast can be comfortable. Because once we block by using the cold compressions, the cycle is broken. The cycle of the 3Bs we talked about yesterday, of the breast and the brain, is broken for a minute and the capillaries are shut. So we'll have a nice time to express and to take care of the breast, and now the milk production will be replaced little by little, small by small, until the right time as we help the baby breastfeed. All right? So thank you very much for keeping here with us. We'll be doing this as promised, and we hope you are learning. Share this with your friends. Knowledge is power. We are here, and thank you. I'm going to drop my line and my email address just in case. Asante.